You may not believe this, but do you know that it is possible that you may not be the only one eating your food each time you eat?
What do you mean?
Some invisible creatures are chopping from your food. I know you will do this, I know. But before you reject it, understand what I'm saying. These invisible beings are not your village people. Neither are they some unseen spirits. Rather, they are some unscrupulous, parasitic, tubular body, slimy creatures called worms.
Oh my God. Look at the kind of grammar you're speaking.
Who have pitched their tent in your guts. Maybe that's why you don't have the guts again. Because these guys have taken over your guts. Interestingly, they can be there, raising families, multiplying, and if care is not taken, they may soon chase you out.
You see, for this life, you don't go make person, they use former eye, the judge person.
They are still tenants now, but beware before they change it for you. I mean, before tenants turns to the landlord of the house.
As how?
They have changed it for some people before. They are multiplied so tight that they have blocked some people's intestine. Before, they used to just chop from the patient's food, from your intestine. They chop some portion from the food. But at some point, they now say, food, you go nowhere again.
God have mercy upon us.
What an effrontery. These guys got the guts. Worms are a type of parasite, and which are organisms that live on or in other organisms, other living hosts, and survive by taking nutrients from them. You eat, and they eat from what you eat.
What?
What do you mean?
Mommy, that's why these children are never full on time. You give them food, they keep complaining, they want more. You know why?
Why?
Maybe they are not the only one eating your food. Mommy, they may not be the only one eating your food.
That's why.
One parasite are also known as helminths. So when they infest the human, we call that helminthiasis. There are different types of these helminths, these worms that infect the humans. They include, but are not limited to, the following: roundworm. The name of the worm is ascari. The next are hookworms. We also have tapeworms, beef and pork tapeworms. And the name of the worm is Tania. The next are whipworms. The name of the organism is trichuria. So in fact, for completion, we call it trichuria. Our emphasis is, however, on these common ones. There are many others, but these are the ones that get into your body. They rent houses in your intestine. That is, they inhabit the human gut. Many a times, patient is asymptomatic. Asymptomatic means may not have any symptoms. And even when there are symptoms, they are usually non-specific or atypical clinical symptoms, meaning they don't clearly define the disease. You can't see those symptoms and say that you are sure that this person has worm infection.
You mean that?
Most will not even develop symptoms until a long time after the infection, when there is a heavy infestation by the worm, the parasite. Be the following symptoms in worm infection. There could be nausea, that's the feeling of vomiting. There could be abdominal pain, which can be a dull or vague form of abdominal pain. At times, it could be some kind of colicky, as if the intestine is twisting, It could give that kind of abdominal pain. You could have bloating. There could be diarrhea, which is the frequent passage of stool or passage of loose or watery stool. One will have constipation. There could be appetite loss, weight loss, body fatigue or tiredness. Someone may even cause anemia. Let me call it what you people call it: shortage of blood.
Okay.
At times, you could see roundworms visibly in feces in the stool. That may indicate that there are many there. They are already a kingdom. So the one you saw was just banned or sent into exile, and that's why you saw it. For tapeworm, people get tapeworm by eating undercooked beef or pork that contains cysts of the tapeworm. You eat suya every now and then, and you think that this deworming does not concern you. You must be joking.
What?
For the roundworms, the feces of an infected person containing roundworm eggs are discharged into the environment. Or the feces of a person or animals containing roundworm eggs are used as fertilizers for your crops, vegetables, and the likes. And somehow, the eggs now find its way to the mouth. And this is what we call the fecal-oral route. The fecal from feces, oral, so from feces to the mouth. It doesn't mean that you are directly packing human feces containing the cyst or the egg and eating it.
Will you tell this man to shut his gut?
Therefore, eating with contaminated eggs or eating undercooked vegetables or fruits that have not been washed properly poses you at a risk of disease.
I thought I was the only person.
When washing your hands, it's important to do it appropriately so that you can be sure that you have washed everywhere on the hand where the eggs may be hiding. Mind you, these eggs are microscopic, meaning that you can't see them with your naked eye. Only people who have never seen before can see them with their naked eye. And I doubt if that can be you.
God have mercy upon us. God, let go.
People swallow worm eggs, and when these eggs reach the small intestine, the eggs hatch to release the baby worm. That then develops in the intestine into the adult worm. Well, it's not that straightforward, but let me spare you of the details. The female worm then continues reproducing, laying eggs, which they do very quickly, as much as hundreds of thousands of eggs per day. 200,000, 300,000 eggs per day per adult worm.
God.
These eggs are then also passed out when excreted in feces into the environment. Some people will now even do short puts join.
It's not me, maybe it's cake. Shut up!
Examining fresh stool samples in the lab, looking out for worms or worm parts that we call segments or eggs in stool sample. Seeing the eggs, like I said, will require a microscope. So worms can cause a reduced availability and a poor absorption of food nutrients in your stomach and your small intestine, which on a long term will lead to a poor physical development. I mean, that's malnutrition. So the child especially will have a poor height and weight. They lead to deficiency of nutrients such as vitamins, iron deficiency, protein deficiency, and so on. Intestinal worms, helminth infections, in addition to their nutritional effects on their host, can impair the mental growth of children and can thwart their educational achievement. This may be a reason why, that child does not know book. Don't you think so? Somebody is already thinking that maybe that was why I was not so smart, so sharp when you were much younger. Not me, the person. Well, now you talk. Me! When the body is infested with large number of worms, there could be more severe symptoms. And this is more profound in children. An infected person may vomit worms.
What?
The worm can multiply and become so many in the intestine that they may block the intestines. And that's what we call intestinal obstruction. Some may even require surgery to relieve the obstruction. Some of these worms, they can stray away outside of the intestine and start entering neighboring organs associated with the digestive system. For instance, they can enter the appendix and cause it to be inflamed, a condition we call appendicitis. They can enter the path to the gallbladder, an organ that stores up bile, a digestive juice, and can block the pathway. Thus, they can block the bile duct, making it impossible for the gallbladder to empty its contents into the intestine, where it's supposed to work on the digestive food. The bile then builds up, and in no time, it begins to affect the gallbladder. It gets inflamed, and then we have another itis, cholecystitis. Sadly, the straying worm can also perforate the intestine. Rarely though, but these are things that have happened before. Almost everyone should deworm, except in 4 groups of people. So deworming should be avoided in the following. Number 1, in children under the age of 12 months, that is children less than 1 year old. Number 2, pregnant women who are in their first trimester. So if you intend to become pregnant, you should deworm actively a few months in advance.
Okay, now point.
Number 3, breastfeeding women. If there is a compelling need to eliminate worms and you are breastfeeding, you may need to see your doctor. There may be a need to stop breastfeeding for a few days while you take the drugs, but that would be under the guidance of your doctor specialist. The same goes for the group I mentioned earlier. That's pregnant women in their first trimester, and children under the age of 12 months. Please see your specialist if you think deworming might be necessary in you. Number 4 is people with liver or kidney disease. People with liver or kidney diseases, we need to see their doctor if they see a need to also deworm. The best frequency of deworming is every 2 to 3 times in a year. In other words, every 4 months or every 6 months. Twice a year or 3 times in a year. The recommended deworming drugs are those that will kill effectively the majority, up to 98% of common worms that you have around. So you don't have to want to determine which of the worms that you have so that you can know which particular drug to use. Most of these drugs that we use, like I said, will destroy the majority of the common worms that we have around. Such drugs are called broad spectrum. Some work by preventing the worm from absorbing sugar or glucose so that the worm loses energy and dies, while others paralyze the muscles so that they become very weak and the body can therefore eliminate the worm through feces. Examples of the drugs that will work for the parasitic worms in the intestine and more include
Shut up, everybody. Listen.
albendazole, mebendazole, praziquantel. I would recommend albendazole and mebendazole. These are over-the-counter drugs that you can buy at any pharmacy store for yourselves, and even for your family. The dose of mebendazole dewormer is non-toxic for both children and adults. So each individual, whether children or the adult, only needs to take a single dose of 500 milligram single dose of the chewable tablet to remove all the common worms. I'm sure a question you have is that when is best time to use dewormers?
We know.
Any time of the day, morning, afternoon, night, what have you. It can also be taken on an empty or full stomach. Users do not need to fast or drink like it was required in the traditional anti-worm drugs. For albendazole, the adult dose is 400 milligrams as a single dose, at once. The doses in children for albendazole should be based on weight. Check the drug information label for the dosage in children or see your doctor. If you cannot swallow the tablet as a whole, you can crush or chew it and then drink a full glass of water. The drugs generally are well tolerated, but report any strange side effect to your doctor. If your other medications, see your doctor to ask if you can use your other medications with the albendazole. In addition to periodic deworming, you should do the following. 1. Good hand hygiene. Wash your hands before eating and after going to the toilet, after gardening, before eating or before drinking. Always wash fruits and vegetables before eating them. Wash your hands, vegetables and fruits over a running tap or simulate a running tap. If you don't have a tap, you can ask someone to pour the water from the top, and the reason is because if you try to rinse your hand, vegetables or fruit in the water, put in a bowl, by the time you rinse the egg of the worm into the water, and by the time you are picking it out of the bowl of water, there's a possibility that you are picking along again the fruit you just washed, what you thought you have washed away. Don't forget that these eggs are microscopic. Keep your nails short. This is very important for children. Ensure that you keep the nails of children short. Cook your beef and pork thoroughly. Wear shoes when in areas of soils that may be contaminated with animal or human feces. Wash your hands after handling dogs. Ensure that your dogs and animals, cattle, are regularly dewormed with deworming tablets. You can consult a vet doctor for that purpose. Ensure adequate water and sanitation facilities. Lastly, avoid indiscriminate defecation around.
Any more of that from you, and make sure you spend the next 10 years in Kirikiri prison.
Avoid the short puts and the long throws.
You get it?
Okay.
Kindly like and share this video. Subscribe to this YouTube channel if you are yet to do so. The subscription button is just right there below. Click it. It won't take more than once. Remember, your health comes first. The short put and the long throw. The short put and the long throw. The short